international professionals opposing fluoridation list now has nearly 4,700 people, including a former Belgian Minister of Health, a former Federal Health Minister of Australia, and Swedish Nobel Prize winner Dr. Arvid Carlsson, Nobel Prize in Medicine in 2000. Our New Zealand fluoridation list now has 338 professionals. More than half are doctors, dental professionals, and nurses. The Ministry of Health is doing a great job at most things. However, a few key people there know that fluoridation is harmful and a failure. A few of them have even admitted it in various ways. I want to show you their own clear evidence that fluoridation doesn't work, evidence from them. One of the most important angles on fluoridation for most people is, does it work? Simply, does it work? The answer is no. The seductive 40% difference claim advertised by our Ministry of Health is false. I want you to clearly see how this claim is false, because fluoridation is entirely built upon this. There are only a few individuals at the Ministry of Health who have manipulated some of their useless, misleading, and inferior data.
I think we want to be careful just about some of the words we use about misleading.
I'm talking about the data.
Yeah, I'm just asking you to put your case.
Okay. To advertise this seductive number. These salespeople have been calling the shots. They've deliberately not advertised their own superior data to show 40% or more in our favor, showing that fluoridation does not work. We use the Ministry of Health's own database of thousands of New Zealand children and the Ministry's own calculation methods to turn the tables back on them. They used a single tiny study from 2008, published 2009, with messy and unclear data, and have been calling it 40% magic ever since. This is what they're advertising. This is how they're selling you. The big secret is in plain sight in the published New Zealand school dental records annually. Fluoridated areas have 40% or more tooth decay than non-fluoridated areas. You've been told the reverse. I volunteer to do this because it's incompetence at best and fraud at worst. Let's take a look. This graph, if you go through, if you can see it better in front of you, it's in here. This graph shows how we turn the tables on that 40% number against the Ministry of Health claim. The Ministry of Health's way of manipulating numbers can also be used in the reverse. This graph has the statistics that the Ministry of Health released 2 weeks ago. They are the most up-to-date data available. There are 47,000 children represented in this graph, all age 5s in New Zealand. All of these New Zealand areas are fluoridated, except non-fluoridated Christchurch and Canterbury. You can see that all of the fluoridated areas have more fillings than non-fluoridated Christchurch and Canterbury. And one of them has 44% more tooth decay. Its population is the same size as Canterbury and Christchurch group. And in this most recent data, fluoridated Auckland has 26% more decay than fluoridated kids in Christchurch. And the fluoridated kids of the national average had 19% more decay than the non-fluoridated kids in Christchurch. This data comes from Ministry of Health's own database, 50,000 kids, all age 5s and age 12s across New Zealand. This is an appropriate sample size to use to see if fluoridation works, and it shows that fluoridation doesn't work. So the Ministry of Health doesn't advertise this. If fluoridation worked, fluoridated kids would always have better teeth than non-fluoridated kids. They absolutely don't. Non-fluoridated kids across New Zealand now are better more than half the time and in more than half of the fluoridated areas. This graph shows that fluoridated 40% less tooth decay claim is not true. Their magic 40 is from an obscure, tiny, and old study from 9 years ago, shamelessly cherry-picked, and still falsely advertised. This graph is from the latest available, highest quality data from them, 2 weeks ago published, calculated accurately by their own methods. Their magic 40, next page, do that. Their magic 40 that they advertised wasn't even 40. It was 37.5%. Good place to stand. And they rounded it up. This was confirmed, by the way, by an official Information Act request last month. Not a good look for them at the start of this comparison table. Let's compare the inferior data that they used to come up with their magic 40 and contrast it, theirs and ours, with the data that we used, provided by their own data, but that they sweep under the carpet. Our non-fluoridated 40% calculations, we calculated them accurately. They rounded it up. Our group size was 25,000 kids. Theirs was less than 1,000 children. Our data shows 5 and 8-year-olds with baby teeth, 5-year-olds, adult teeth, 12-year-olds. Their tiny study of 1,000 kids was obscured from ages 2 to 17. They included all of that together. So you can't compare that to any other international statistics because international statistics always separate age 5s and age 12s. That's science. Ours is grouped by location so that we know which areas are fluoridated and which are not, how many kids are in each. They haven't indicated on their survey how many kids were in each area. Which sample size was larger? Were they the same? We don't know. Also, the data we've used for our graph shows very clear analysis for ethnic breakdown. They haven't clearly illustrated any socioeconomic factors at all in their 1,000 children study. Also, that survey, our oral health survey published in 2009 from data from 2008, states clearly in the text that it shouldn't be used as a fluoridation study. If you want to read that quote, it's in my written submission. If you're interested in how that magic 40% is calculated, you can see how they crunch the numbers in my written submission as well. We did it the same way they did it to make our point that we can turn the tables on them. And it's a ridiculous way to manipulate statistics. It's an embarrassment for me to present this information in our favor because I know that these differences are tiny and they're trying to advertise it as this impressive figure of 40%. When I've turned the tables, I'm embarrassed. It's a ridiculous way to manipulate these statistics. What does 40% less tooth decay even mean? What does that look like? This is the most shocking thing of all. Dental professionals know that the figures used above to calculate the false, to calculate these 40% statistically meaningless. This impressive sounding number, 40%, is used to deceive lay people and politicians. 40%, they think that refers to the number of children or the number of teeth in a mouth. 40%, that's so impressive. 40% is not kids in a room, it's not teeth in a mouth, it's actually this. The imaginary Zach decay is recorded as 1 filled tooth, Ann's is recorded as 2 filled teeth. Even though Zach clearly has more decay, this raises the average rate of fillings in Ann's town. This goes both ways, and dentists know that these measurements and tiny recorded differences are meaningless. It only matters when the numbers are very different, and they're not. In New Zealand, they're not. Not for the most part. And remember, in New Zealand, non-fluoridated places are actually better most of the time. This is the Child Smile program, which I hope you've heard a lot about from our presenters this week and last week. The Health Select Committee can, instead of passing this bill, help everyone win by passing new legislation providing central government funding to begin Child Smile in New Zealand. The program is saving Scotland more than £5 million a year. It's preventing general anesthetic surgeries on toddlers. And they have never had fluoridation in Scotland. Scottish children used to have very high levels of tooth decay, but now that they have Child Smile, Scottish kids have got better teeth than Kiwi kids. Much better. The blue line is where Scottish kids' tooth decay was very high before Child Smile. It's come way down here. same amount of time. New Zealand's is exactly the same. There are other successful programs around the world now modeled after the Child Smile program. Saving teeth, saving pain, saving money. It's a win for everyone. Be heroes. Start the Child Smile program in New Zealand.
Thank you. Thank you for all your effort that you put in. Yeah.
We can answer any question you have.
Thank you.
Thanks, Lynn.
Thank you.
Thank you.
We appreciate that.